Kentucky will again consider whether to invest in studying the psychedelic drug Ibogaine as a way to treat drug addiction. I'm Alex Acquisto, covering health and politics for the Lexington Herald-Leader, and in 2023, I first wrote about a proposal to use opioid lawsuit settlement dollars to study Ibogaine. It's classified as a Schedule I drug, which is the same classification as heroin and ecstasy, meaning it's illegal right now in the United States. It's derived from the bark of an iboga tree, which is native to Africa. Ibogaine first gained traction in the veteran community as a way to treat post-traumatic stress disorder, but it has slowly emerged within the recovery community as a way to curb drug addiction. In 2023, a guy named Brian Hubbard brought the proposal forward in Kentucky when he was head of the state's Opioid Abatement Advisory Commission. He wanted to use $42 million to help fund clinical trials of Ibogaine to help it get FDA approved, the major hurdle before a drug can be widely prescribed. But Hubbard was removed from by then incoming Attorney General Russell Coleman, and his proposal was left on the cutting room floor. Hubbard shopped the proposal to other states over the next year and eventually found success in Texas, whose legislature in June voted to allocate $50 million to study the therapeutic potential of Ibogaine. On the heels of that decision, in Kentucky, Republican Senator Donald Douglas has proposed picking up where Hubbard left off. Douglas pitched the idea by saying, "The country has been using the same clinical model to treat addiction for decades, and it doesn't work for everyone." That was the case with Jessica Blackburn Allen, who first shared her story with me 2 years ago and spoke alongside Douglas in Frankfurt last month. Jessica took Ibogaine in 2009 in Mexico when she was in her early 20s. She'd been addicted to heroin and pills since she was a teenager, and none of the currently available medications or treatment options worked for her. She was given 2 doses of Ibogaine, laid on a bed wearing headphones and a blindfold for hours, and she hallucinated vividly. When she woke up, she said her cravings, not just for opioids but for cigarettes, had diminished entirely too. "It felt too good to be true at the time," she said, but she's been sober for a decade. Governor Andy Beshear is skeptical of Ibogaine, saying last month, "We've got a treatment system that works, so let's make sure we're not just looking at the next bright, shiny object." I'm Alex Acquisto, covering health and politics for the Lexington Herald-Leader. Thanks for watching.